The Academy of Medicine Specialties of Nigeria has issued an urgent advisory on Nigeria's COVID-19 trajectory and recommended to the federal government to consider a temporary closure of Nigeria's international airports, at least for a period of 2 weeks. Well, for greater understanding of this advisory, we are now being joined by Professor Oladapo Ashiru, President, Academy of Medicine Specialties of Nigeria. Welcome to the program, Professor Ashiru. Good to have you here. Good morning.
Thank you very much. It's a pleasure to be here. Thank you.
Well, Prof, we'd like you to just take us through the recommendations of the Academy of Medicine Specialties of Nigeria. We discussed that on this program yesterday, and we tried to reflect on some of your recommendations. The closure of the international airports, concern about variants, the Nigerian variant, the Indian variant, the Chinese variant being in Nigeria, and implications for our safety. If you could just take us through those recommendations by your group and why those recommendations are important.
Yeah. Thank you very much. Well, over the years, in the last decade, Nigeria has experienced a number of infectious pandemic, and the way and manner in which we're able to scientifically apply medical science to cope with it has saved us. In particular, when the Ebola crisis came, some of us gave advice immediately that they should try and start some control measures at the borders. And that was what even helped for some alertness. And then, of course, what happened with Dr. Ameyo at the First Consultant Clinic, able to arrest this. So the country needs to be sensitized regularly and periodically when there is an infectious disease that is coming around that could take the form of a pandemic. And when this COVID-19 started, we gave information that this is coming because it started in Kenya, in India, in China, and so we begin to look at how we can be able to suppress this and control it at our borders. The first port of entry of such pandemics is from the border. And it took a long time for the government to close the airport, but they were already aware, due to the sensitization of the medical science, that this is coming. Check your ports to make sure that people who are coming in can be checked for their temperature or signs of this disorder. Unfortunately, now we have a pandemic, which is a rapidly changing pandemic, which is the SARS-CoV-2, known as COVID-19. This virus is an RNA virus that changes. And as you said, it has multiplied into variants. So we have now what we call double mutation and triple mutation. The consequences of that is that now in India, and why we're afraid is that originally about 3 months ago, we thought we in Africa, we are not so affected, because if you look at today, the number of people infected with COVID-19 in Nigeria is just under 165,000 compared to other countries that are going to the 500,000. And the number of deaths in our country is just above 2,000. We had the same pattern with India, and people came with theory that maybe we have some immunity from the sun, from vitamin D, or endemic immunity, and so on. Now, the problem now is this. That same condition occurred in India. Now, they have now activated a strain of virus that they are now having infection in the level of 350,000 per day, and it's rising. So we cannot afford to have that in Nigeria because we cannot cope. And that is why the Academy of Medicine Specialties has a rapid response initiative group, which headed by one Professor Obiana Onyejekwe, and has a number of virologists such as Professor Tomori, Professor Milabri, and many of them are in this group. And the charge is that they should, and we have one Professor Christian Happy, who is doing the molecular staining characterization of this virus at Redeem University. And they've been able to show that there are variants even in Osun and other parts of the country as we speak. Now, this entry of these variants is from the airport. And now that India is having this, we have to know that the movement from India to Nigeria, we don't have direct flights. So flights are coming from Ethiopia and other places. So we need to watch our airport, and we need to temporarily halt it, not for more than 2 weeks, just to assess what is going on. I know that for business and the industries, we think that it's going to be a problem. But look at what happened in UK. Boris Johnson has been able to be very firm in having a lockdown and all sorts of process applied, so that now they are enjoying the benefit of that control. Unfortunately, our vaccine outlay is very low. We got 3 million, and just about 1.5 people have been vaccinated with the first attempt. So we have a problem that if such a virus should get into the country, we will be very severely affected. This is why our government needs to take heed and listen to the advice of the sciences. Our committee, the group that looks after this, have made this advice. They may look at, if they don't want to close it, they need to ensure that the border is secured. But you know, in our country, people can go through at various levels. Canada today has banned flights from India into their country. And another country said that 52 people flew in from India into their country in Hong Kong, and they tested negative when they boarded the plane, but on arriving in their country, they were now positive. And the problem is the rapid transmissible capacity of this virus. And so, apart from this, yes.
Thank you, sir, for that advisory.
I want to advise that what is more important for us is to have protection of the face mask and to maintain our social distancing, to do the PTF recommendation of hand washing and sanitizing.
Well, thank you, sir. I'm sorry, I thought you were rounding up. Thank you for your advisory and for coming here to further amplify it. It's extremely important. But what you have suggested as a policy decision for Nigeria should be similar to Hong Kong and their emergency circuit breaker, a 14-day ban. But other countries are implementing a 30-day ban. Why don't you recommend that in the Nigerian context?
Well, we're looking at the effect it may have on our economy because we're just beginning to pick up. 30-day ban may be too severe on our own public here because if we have a very firm port control, and we can, in that 2 weeks, establish a procedure where people can go in and be quarantined. In Canada, when you fly into their country, they get you to stay in a quarantine hotel by the airport. And according to the state, some stay for 3 days, some stay for 8 days to make sure that they are negative before they can go back into the town. So we don't have anything yet in this country, and I think we must do so. In England, they make you quarantine and they check your telephone to make sure that you are not going to the city. We don't have problem in letting people into the country after all these things have been properly secured. Each airport must have ability to check. Even if they are negative, they must be quarantined and retested before they can go and mix with the public. That's what the academy thinks.
All right. I mean, great insight and great work you've been doing at the academy with Professor Happy and the likes in there. But real quickly, I want to talk about something very important that you raised. Is how we even, think of managing COVID-19. And what you are saying now reminds me of this same time, a couple of months before last year, when there were cries to shut down the country, to shut down the airspace. And the people that came in after the 2-week window before they shut down were the ones that brought in a lot of the cases we had. And the cases increased in Nigeria. And there were talks about them being VIPs and the likes and other things.
Correct.
So is that not repeating itself now? Are we not having that same episode? You've raised the alarm that we should shut down, and a lot of people are still saying, no, let's let people in.
Yes, that you are very correct. This is a problem in Nigeria. We have a country of VIPs, VVVIPs, and things like that. Whereas in other governments, they don't care about that. If you can see what happened even in UK when they were asked to lock down, and a cabinet minister drove to see his family, and he was severely criticized. So we should be able to apply laws that make sense, and everybody should be able to follow them. The problem is that we're not out of the woods yet in this country. More worrying is the way people are going about in the country, like they are not concerned, like there's nothing like this thing. And we know some of our own colleagues that have died from this process. Many. And so people need to take caution, and government needs to listen to what the science is saying. We are not saying this we are saying this based on what we know can happen. We can slow down. Our country has been lucky so far. I mean, 2,000 deaths in compared to other countries, although I know that it may even be more than that because our recording system may not be accurate, but that is about what we have in terms of the level of infection, 165,000. So we need to keep it at that level until the vaccine can come in to help to vaccinate our public. And look at the vaccine we have, just 3 million. We're not buying vaccine to support that. Luckily, some countries are going to ship vaccines, but they are shipping it now to India. So Nigeria needs to wake up and do something. Otherwise, because we cannot handle what is going on in India right now. That is our worry. It's a very scary state.
Well, Prof, I like your point about following the science. In those countries where they refuse to follow science and they follow the myth and superstition, they pay the heavy price for it. And I think in Nigeria we should follow the science. But your Academy of Medicine Specialties, you have issued a press statement. You are on television now. But what efforts are you making to engage with the relevant departments of state, the Center for Disease Control, the Ministry of Health, and also perhaps the Primary Healthcare Development Agency that is in charge of the immunization program? Is this all about press statement, media appearance, rather than concrete, constructive engagement? By the way, I like your tie, Prof. Looks nice.
Thank you. Thank you. Let me tell you what we are doing. The academy is a broad-based academy of medicine. We have people at the basic medical science, people at the basic clinical science, dental science. Now, when this academy has a separate department, this is similar to the Academy of Medicine in the US, a rapid response initiative group. What this group does, we have them for different events. This particular one is for pandemics. The members are virologists. Professor Tomori is there. Professor Omelabu. These are the people who combated the Ebola virus. Professor Ogunshola, Shadow Ogunshola. These are people who work in the field. Their hands are on the bench. And then Professor Christian Happy from Redeem University with Tomori. They have been able to do the molecular genetic characterization of the virus. And then we have Professor Oyemelikwe, Professor Bina, and some of these people are on the the task force that reports to the Minister of Health. So it's not that we're just working and not making our voice heard to the ministry. They report to the Ministerial Advisory Committee, task force. So we have about 3 members in that task force. Professor Oyemelikwe is there. So we have quite a number of people, and Professor Yahya Mohammed, who, these are all experts in their various fields. Professor Akin Oshibogun is the chairman of the Lagos State Task Force on primary healthcare and also in charge of this. So they work in different aspects of the country to give their advice in this area. But the academy is an umbrella that can assemble these people together and get them into committees to advise us, which we can now give to the public and to the government. So it makes it no longer an individual expression. This is not Professor Ashiru speaking, but it's an academy. So we're able to, and this is like what happens in the US, where the Academy of Medicine tells the government this is the way they think people should go. And I think such communication from an academy like this of medical specialties will make the public to believe what is going on than think that it is politics or it is myth. And so I still advise people that they should take their supplements like zinc, like vitamin C and vitamin D, which have been known to help to build your immunity. And at one point, we had also recommended the use of ivermectin. And these are still things that are around, if you are not yet immunized, that can help you to build your immunity. And definitely, there is nothing as safe as using the mask and social distancing. If the whole public can wear masks like they do in some countries, then we'll be safe.
Thank you, sir. We really ought to have beaten this virus by now, if only everybody had just done what you said. But alas, here we still are. Now, with regards to your last statement, I wanted to take your...
There was a party recently, and people were there without any mask. They were all mixing together.
Okay.
Yes, what happened in India was that they had an anniversary, a festival, and they came there in large numbers. The government should have banned that festival.
They
and this is the outcome.
Well, we're going on a break, so I'll just say they could have used the model they used in Saudi Arabia with the pilgrimage, where they stopped the pilgrims from going to get Zamzam water, the holy water. They bottled it. But we're going to take a short break, and I think, can I ask the question or wait? Okay. Sorry? Okay, so we'll take a short break now, sir, and we'll be back with more with you. Please stay with us. Welcome back to the morning show here on Arise News. We're still with Professor Oladapo Ashiru, President, Academy of Medicine Specialties of Nigeria. Before we went on the breaks, I wanted to ask you a question. The American CDC, their travel advisory says that even those who are fully vaccinated should avoid travel to India because you can still transmit the virus. I'd like you to respond to that. And also, what was your response, or what is your response to the manic scenes that we're getting from India, with patients being turned away from hospitals, dying in their cars, oxygen being sourced at the black market, mostly unsuccessfully, funeral pyres burning 24 hours a day? How do you feel about those scenes as a Nigerian when our doctors have just recently suspended their strike because they're just so beleaguered and underappreciated?
Well, it's a very sad story, very sad story. And I'm very happy that our doctors have suspended their strike. And I think that the more our government can take more appreciation for our doctors, the better. Now, what is going on in India is unbelievable, because when people die at a rate that is beyond the capacity of their infrastructural manpower to handle it, this is what will happen. The population of India is at a very high rate, and people are dying at the level that the infrastructure they have in the medical services cannot cope. Now, your second question had to do with the vaccination and traveling. When you are fully vaccinated, it is now hoped that by summer, people who are fully vaccinated, they can travel to another country that there is at least more than 75 to 80% of the people are vaccinated. But if you go from America, where you get your full vaccination, to India, we now know that even though the type of vaccine you have, once you have a double vaccination, you may be protected from those variants. However, if you carry them, you can transmit it to somebody else who is not vaccinated. So I think that is the problem. And the point is that this is a novel disease. We are still doing a lot of studies to check how it will go, and that is why people should exercise a lot of caution. For example, if people are all vaccinated with their double vaccine or single Johnson & Johnson vaccine, you can be together in an environment or in a workplace where the other members are vaccinated. But when you cross the line to a population that is not vaccinated, you can get infected with the strain of the virus, although it may not have any severe effect on you as to cause illnesses or death, because you're already having a lot of antibodies to cope. But it can still travel, it could still remain in your body for some time. So that is the problem.
Right. Prof, thank you so much for the insight you've been sharing. You are a professor of endocrinology, and I have a basic knowledge of endocrinology 501, at elementary level. And I know that this virus has been said to affect the hormonal system in the body, I'm talking about the pituitary glands, the glands that secrete hormone, pancreatic glands, and the likes. I mean, is there any detailed research done in Nigeria, maybe from those samples the likes of Professor Happy is taking, of the effect on this on Nigeria? Because there's a long haul effect. In fact, it's called long COVID. Some people still reel from the effect of COVID about a year after. So maybe if messages like that are out in the public, people too can understand the severity of this.
You're very correct. There's still a lot of studies going on the effect of COVID as it affects the endocrine glands and the reproductive organs. For example, we are looking at the traces of this in the male reproductive system, in the sperm. So it could be transmitted through the sperm, and people are looking at the effect of having COVID on the baby. That is why we now know that vaccination can be done even when you are pregnant, to protect the mother and the child from pregnancy. And a woman that is vaccinated during pregnancy may be able to transmit the vaccine, the vaccine to the baby, so the baby can get some immunity from the mother. But in terms of the destruction of the endocrine system, it is substantial, because you are looking at the cytokine storm that affects the blood circulation. And the endocrine glands, they function through blood circulation, not through the nerves. So anything that disturbs their circulatory supply is bound to compromise their function. And even if you look at it in the normal person. But in vivo studies will commence as long as we are able to have funding to support this. This is why the academy is, in our launching, we are asking for significant fund support so that we can initiate a lot of project research in different aspects. We don't have to wait. Right now, what we are doing is seeing the results of studies in America and in India, and in UK and Japan and China. Some of my friends who are professors in China, I had to contact them when this epidemic started. How do you manage this epidemic? And that is how they gave me a compendium of books on how to do this. But we should be able to do something for even to find out why the spread in this our country is not as much as it is in other places. But we need funds to do this and to initiate a lot of research in different university centers. Hopefully, I'm sure that this academy, which is a young academy, in the next 5 years should be a flagship to advise the country on a number of issues, just as we have done, and to assist the Nigerian Center for Disease Control and other issues and other health problems. Our priority is to promote health for the country and to give a general well-being for the population.
Well,
And
Prof,
that
I
is
would
what
like you to
we
comment.
strive to do.
Prof, I'd like you to comment on two issues raised in the statement that your academy issued. The first has to do with the concern about the likelihood of a third wave. Is a third wave inevitable in Nigeria? And, the effect that we have seen in that regard in India is frightening. Are we likely to witness that kind of situation? And the second one has to do with what you referred to in that statement as low vaccine outlay. What should the Nigerian government do about the low vaccine outlay? Because it looks like we face a situation whereby many of the persons who have received the first dose of the vaccine, AstraZeneca vaccine, may not in fact be able to get the second dose. What would be your recommendation to government in that regard?
Your first question, in terms of the third wave could be very imminent. And that is a very, very disastrous situation. And that is why we are raising that alarm now, that government should do something. It is not, when something is coming, you have to be ready to prevent it. And you could see that, like you said, if you ignore science, you ignore it at your own peril. And when America ignored it for a long time, now see what they're doing. We are telling government to do something to ensure that they can control the influx from India. These people now are going to come back on their vacation. They've gone for this holiday to celebrate their festival. They're coming back and they come back into the country. If we do not, and even some of them are able to, are here to bribe their way through different situations. So if you do not make sure that when they come back, we have a model to control, to ensure that they are quarantined, and we are able to show that they do a genuine test that makes sure that they are negative before they can go into the community, we have a problem within our hand. And that strain that they have is a very virulent strain, as you can see the manifestations. After all, India had the original strain before, and they were able to cope. But this current strain, which is a mutated strain, is difficult. And we think that it could be a triple mutation in which the protein that is carrying the virus is able to alter regularly. So those are the things that I think we need to do to stem it off. if we do not do it, we'll have problem in our hand. And then your second question has to do with, what was it again? Tell
Vaccine
me.
outlay. Low vaccine outlay. Vaccine
Yes.
outlay.
You know, the vaccine we have in Nigeria is from COVAX. It's free. Ghana had the same amount, free 4 million vaccine, but they bought 6 million. I think Nigeria, for their population of about 50 million, we should do better. We should be able to have the 4 million free vaccine. We should be able to buy some and to be able to immunize us. At least we need to target 60% of the population. And luckily, some free ones are coming, but I believe that we need to invest on this vaccine so that we can hold ourselves above water. And the academy is also trying to educate the populace to educate them to prevent vaccine hesitancy, to know that this vaccination has been there from the beginning. We had vaccination for smallpox. We had it for yellow fever. We had it for measles, mumps. It's the same technology. And luckily, AstraZeneca employs those same technology that was used to make those to make it. So why are we now hesitant? Because some politicians wanted to do some tricks on it.
On that note, Professor Ashiru, thank you very much for joining us, and thank you very much indeed for your insights.